Vertical Labret Piercings. Everything you need to know before you get it done. Coming up next on Consultations by a Piercer, episode number 30. So stick around. For those that are new to the channel, welcome to the channel. Welcome to the Body Piercing and Tattooing channel. I hope you're enjoying the videos, but you might not know who I am. So just to clarify that, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and I operate the Axiom Body Piercing Studio located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. The piercing we're talking about today is an oral piercing. It is done dead center on the lip, bottom lip, of course. Pointing almost directly up, thus vertical, as in vertical, opposed to horizontal. This is done more outside the mouth, done with a curved barbell. You can wear a ring in it, but I don't suggest healing one with a ring or a circular barbell in it. The curved barbells work best, but we'll get more into that a little bit later. As far as healing, you're looking at a healing time anywhere from 8 to 12 weeks, during which time you need to clean it twice daily using a sterile saline. Personally, I like NeoMed's Piercing Aftercare because it comes out in a fine mist. However, if that's not available in your part of the world or you're not, you don't have accessibility to it, a good alternative is any sterile saline spray. It should be in a pressurized can. It should say sterile on the packaging. And when you turn it over and you look at the ingredients, it says two things: water and sodium chloride, aka salt. Nothing else. If it says it has the healing power of the ocean or any other nonsense, that's not what you want. In the way you use that, if you have the mist style, you just mist both sides of it, let it stay in contact for about 5 minutes, and then pat dry any excess. If you have the kind that comes out like a squirt gun, it can hit you at 40 feet, I don't suggest spraying that directly on there. It's not going to feel too good. It's probably going to be pretty wasteful. What you want to do is take a sterile piece of gauze sponge, soak it up, or if that's not available, a folded up clean paper towel can work in a pinch. Saturate it, then lay it against the piercing for roughly about 5 minutes, doing a cold compress. Once you're done with either of those, pat the area dry and leave it alone. That part you want to do twice daily. One other thing I suggest doing is at the end of your shower, pull your hair and everything out of the way and let the water flow over the area for about 30 seconds. What you're doing with those two things is you're helping to remove that limp discharge, that stuff that hardens, collects on the jewelry, the crusties. The reason why I wanted to get it off there is the movement of the jewelry, just when you're talking and eating, etc., and just plain old gravity can agitate the piercing. So the jewelry is going to move slightly regardless of what you do, but getting that discharge off there helps reduce the likelihood of issues. Now, if you can't get it off or it seems like there's an excessive amount on there, don't go to the medicine cabinet and start pulling out every metal object that you can find that you can scrape with and everything that seems to have cotton on the end of it. The more you mess around in there and dig around in there, the more likely you are to cause problems. Also, if you have an obsessive amount of discharge or it's discharging a lot more than normally or it doesn't seem like it wants to come off, you may have other issues. So what I generally suggest, go see your piercer, have them take a look at it, and have them clean it for you. Now, that takes care of the outside. The inside's a little bit different, even though this is mostly outside the mouth. For the first 2 weeks, I generally suggest rinsing with a alcohol-free antiseptic mouthwash. Personally, I like Biotene Antiseptic. It's pretty easy to find. Roughly 30 seconds twice daily. That's all you need to do. Don't rinse 15 or 20 times a day, just twice. The other thing is rinsing with warm water and sea salt. Take a cup of best distilled water, maybe warmed up a little bit in the microwave, drop in 1/8 of a teaspoon or a pinch of sea salt, let it dissolve, and then just kind of rinse with it off and on for about 2 to 3 minutes. That you can do twice daily or as much as needed. Both of those things you only have to do for the first 2 weeks. After that, stop doing it. Now it's time to move on to things you don't want to do. Cross-contamination prevention. Common sense stuff. Wash your hands before you handle it. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. Understand you are more acceptable to STDs during oral sex, even after the piercing heals. So if you switch partners, do us all a favor and practice safe sex like you're supposed to. Do not stick unclean objects in your mouth, and that includes things like toothpicks, pen caps, dirty fingers, other people's dirty fingers, that rock you found on the ground, that sandwich you found on the sidewalk. Don't put any of those things in your mouth, especially when you have a healing piercing. Keep your food utensils clean, meaning clean that silverware and plates and so forth. Also, it's not a bad idea to start with a fresh toothbrush. The other thing is do not share food items or utensils with other people. That should go without saying. That includes drinks, straws, food, sandwiches, anything else. I don't know why I'm stuck on sandwiches today. Do not submerge piercing in bodies of water you cannot control the quality of, which is pretty much everything but your own clean bathtub. I know you're going to get a lot of conflicting things like, oh, just wait 2 weeks and it'll be fine and all this other nonsense. The reality of the situation is this. Any body of water that's large enough for you to submerge your whole body in and move around in is going to contain microorganisms, which, if it gets in that open wound, which your piercing is, for anywhere from 8 to 12 weeks, you're going to get an infection. So to limit that possibility, don't swim. The other thing is understand that swimming, the only way you can't swim without getting water in your mouth. So think about that the next time you start diving into something. The last one is keep pets away from it. Don't let them sleep in the bed with you, especially smaller animals like to sleep up by your face and lick you while you're sleeping. It's kind of creepy when you think about it. Now let's talk about trauma, swelling, and abuse. This piercing can swell. Usually you'll see swelling anywhere from the day after, morning, day after, or maybe a couple days into the process. You really want to reduce and isolate the piercing as much as possible and change your diet, and we'll get to that later. First off, we'll start out with trauma. Do not sleep directly on the piercing. Make sure you're sleeping on your side or your back, or figured out a way to elevate it off the bed so that you're not applying pressure on that piercing all night long. Do not spin, rotate, move, attach foreign objects to, tow boat anchors. Don't play with it. Leave it alone. It's not a fidget spinner. It's not a toy to be played with constantly. Leave it alone. Wait till it heals. You have the rest of your life to play with it and mess up your teeth. Okay? Now let's cut into diet. First 2 weeks especially, you want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, or anything that may agitate your mouth. Also, anything that involves a lot of movement or adjusting of the jewelry or that lower part of your jaw. Talking can add to that, etc. Kind of stick with simplistic foods at first, things like sports shakes, baby food, applesauce, yogurt, ice cream, cold items, popsicles, etc. Anything you can put in a blender and shove down your throat. Eating is going to take a little bit of adaptation, mainly because that thing is dead center on your lip. Also, drinking can be a little uncomfortable, especially out of bottles, but you should be staying away from alcohol anyway. Some other things you want to avoid is carbonated beverages. Anything that has bubbles in it, and soda, beer, pop, any of that stuff is going to agitate that piercing. Now, with this piercing, because it's more outside the mouth, it doesn't seem to affect it as much, but that contact of eating, etc., can cause issues. So be safe, be careful, chew slowly, and if it takes you half an hour to eat a meal, it takes you half an hour to eat a meal. It's better than dealing with all that swelling. And lastly, if it hurts to do something, don't do it. Some ideas on how to reduce swelling. Gently suck on ice chips for the first 24 to 28 hours. Good idea is once you leave the studio and you've got your new piercing, hit a convenience store, buy a giant cup, one of those huge bucket cups, and fill it up with crushed ice, and then gently suck on it for that first day or so. It'll help a lot. Also, staying hydrated, drinking lots of cold liquids, especially throughout the night when your body naturally dehydrates, will help with the swelling. Cold items will help too. Raid the freezer, eat all those popsicles, ice cream, frozen yogurt, all that fun stuff, because that coldness will help reduce the swelling, and it feels good, and it's easy to eat. Sleep with your head elevated above your heart. That will reduce the amount of blood flow to the area, which reduces the amount of swelling. Usually with piercings, you're going to see more swelling in the morning for a couple different reasons. First off being if you don't sleep with your head above your heart. The other one being is that you dehydrate at night because you're not drinking liquids a lot. So that will lead to this more swelling too. One thing I forgot about the food is stay away from salty items. I know people think sports drinks are going to be fantastic, but the reality is that the sodium will lead to more swelling. All of this is going to be very frustrating at first. Take your time. Eventually, it's going to be normal to have that thing there, and it's going to feel stranger to have that jewelry out than to have it in. Just be patient. I know it's frustrating. It's not as bad as maybe a tongue piercing, but it can get a little nutty there. Now let's talk about risks. With any oral piercing, there's two major risks. Three major risks and then two different types of risks, I guess. Something like that. Anyway, enamel erosion, gum erosion, and softening of the bones inside your mouth. Now, this piercing is on the low end with that because it's more outside the mouth and less likely to have contact with your teeth and gums. That is as long as you don't play with the piercing. It's really common with these for people to suck them in and dig around on them all the time. That's going to lead to enamel erosion. So the more you play with it, the more likely you're going to have issues. The other thing is the ends coming unscrewed and swallowing the jewelry. Once again, this is probably one of the lowest risks as far as oral piercings for this because it's so far out of the mouth. However, it's a good idea to make sure that you keep the pieces, the ends, on there tight. Now let's talk about the pain in the experience. Most people say this is either not painful at all or one of the worst experiences they've ever had. There can be a lot of nerve endings grouped close together in the area, so I'm going to go between a 3 and a 6 on a scale of 1 to 10, 10 being the worst. The forceps can be uncomfortable because they kind of pinch a little bit. Afterwards, you're going to have some slight throbbing and aching. That'll usually last a few minutes. Talking, eating, drinking is going to feel uncomfortable when you bump it. And it takes a while to adapt to having that jewelry there and avoiding it. There might be a little bit of slight bleeding off and on for a little while, but usually not too bad with this piercing at all, unless they really just luck out and hit that blood vessel and it starts bleeding. Anatomy. Good news here. Most people have the anatomy to do this piercing. You have a lower lip, you probably can get it done. Where we can position it depends on how formed your lips are and how much curvature outward your bottom lip has. The more flatter it is to the body, the more likely there's going to be risks with enamel erosion and gum erosion, etc., because there's more likelihood of that top ball being in contact with teeth, gums, well, mostly teeth, in the future. But most people, it kind of curves outward, and we do it so that it doesn't come in contact with those things. Now let's talk a little bit about jewelry. With this one, it's best to stick with that curved barbell. They have the lowest profile. The biggest thing with that is you do want to check the balls on a regular basis. It may be pierced with something that's a little bit longer than needed to allow for inflammation, especially if you're prone to swelling, which is something you should discuss with your piercer, and may require downsizing to a shorter barbell and roughly about 4 to 6 weeks on average. Now let's talk about placement and angle. This piercing is placed usually just below. If you pinch down on your lower lip, you'll feel kind of a ridge there. So it's done roughly 1/8 of an inch below that ridge on the underside, and then just inside the smooth or just outside the smooth part of the upper lip. Done almost perfectly vertical, usually at a slightly backward angle. It really depends on your lip and how much it curls outward. Now, when marking this, both sides should be marked. Understand that your face is not perfectly symmetrical, so the idea is to try to make it look straight. When you look at the piercing markings, look at them close up, and then look at them at arm's length or further. Understand that most people do not see you this close up with their eyes open most of the time. They're going to see you at arm's length or longer, and it's more to see how it fits into the full amount of your whole face than it is that tiny little area. Getting out a ruler and measuring side to side may seem like a good idea, but oftentimes the results are not going to be the same. And it should kind of stick straight up and down. If you figure there's an imaginary line that runs from, with me, the widow's peak, that isn't really there anymore, since my hair went to Reseda. And then straight down a line to your nose, and then if you're like me and have a dimpled chin, right to the center of the chin. So kind of picture that, and it should follow that line. Let's finish off with what to consider. First off, this is going to affect eating and talking. If you have any events in your life, any changes in your life, like a big dinner or something coming up social in the future where you're going to have to do a lot of talking, or maybe you have to perform somewhere, monologue, probably not the best piercing to get done. You want to give yourself at least a couple of weeks to kind of get used to the piercing. So plan accordingly. Either do it, a week or 2 to 3 weeks beforehand, or plan on doing it after that event. You're going to have to change your diet. Plan ahead. Buy that food of types of food that are going to be easy to eat, easy to deal with ahead of time. Don't wait until the last minute and be running around right after you got a fresh piercing and going through the stress of that, ordeal. It's usually best to do it ahead of time so you have it all set up and ready to go. Downsizing. If they do have to pierce a bit on the long side, you're going to want to downsize them roughly 4 to 6 weeks. I suggest going back to your piercer and letting them do it. They have the proper tools to do it correctly. And unless you have a guide pin and hemostats and everything that you need to do it safely and with causing the least amount of trauma, I don't suggest doing it at home. Don't just take the jewelry out and shove another one back in there. You're probably going to cause trauma and possibly start the healing process all over again, including the swelling. Do you have any trips in your future? Maybe for business or leisure, a vacation, what have you. I would suggest either getting this done 2 months before that vacation or waiting until you get back and then getting it done. The reason being is first off, you're going to be in a situation where you can't control the environment. There's also going to be the situation where you're going to be exposed to pathogens that maybe you're normally not exposed to, so thus your body hasn't built up an immunity to. The third thing is you're probably going to be eating food and you want to relax and you don't want to be on this restricted diet while you're out there having fun. And the other thing is swimming, and we've already talked about that. It's much better to wait until after that or get it done far enough in advance that it's not going to affect that fun time or that business trip that's kind of stressful. And lastly, sports and hobbies. If you are involved in any organized sports or activities, that there is a governing body and probably a dress code, including a uniform, or you're in something that is like a dramatic play from the 1930s, you're going to probably be told to remove the jewelry. It is always best to check with your coach or whoever's in charge before getting the piercing than to get it done and just hope for the best. The other reality of the situation is you're not going to be able to remove this jewelry for long periods of time. Even after this piercing heals, oral piercings have a long history of closing very rapidly on a majority of people. There's a lot of people out there, and I hear from time to time, it's like, I took my Labret out, I've had it out for 10 years, I don't have problems putting it back in. They are the exception, and usually it's after they've worn those piercings for 5, 6, 7, 8 years. It's not a situation where they got it done 6 months ago and took it out for a couple hours and had no problems getting it back in. It's generally the exact opposite. So plan ahead. If you're involved with something that's not going to allow you to have the piercing, then it's best to wait until you're no longer doing that activity at all and then get it done. Of course, check with your boss too. And as always, isolate, 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 and don't sleep on it. Well, that's all I have to say about vertical labret piercings. Hope you learned something. Till next time, here's hoping all your piercings seal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Have a good day, everybody. Take care, and we'll see you in the next video.